So, welcome. Thank you for coming in. I am Rachel Lowinger. I am a clinical psychologist, and I work in private practice in Lawrence and in Manhattan. And
Want to wait a few minutes? You can wait.
it's okay. We can get started. We have a lot to get through, so.
Yeah.
Yeah, we'll get started and then we'll see how it goes. So, so that's what I do, and I see patients of all walks of life, but bereavement and grief and traumatic kind of experiences is definitely something that I see a lot of. So I feel that it's actually not far off from what we're trying to talk about today. What I was thinking of doing is kind of cover three main areas, like you see in the handout. The first thing is to kind of talk about emotional reactions that people have, because I feel like that's the realm of the private, and people deal with this by themselves, and it's a lot to take, and sometimes it's just nice to kind of have a feeling of what's normal, what do other people feel, what to expect. Then I wanted to talk a little bit about internal conflicts, and that's something that's not just in caregiving, but it's this idea that you have sort of a part of you that's telling you, yes, have the cake, enjoy it, have another piece, and then another part of you is telling you, what are you doing? You should really be watching it. And you're having this internal kind of dialogue that's going back and forth, and how do you sort of come to some kind of outcome out of that? How do you deal with it? What types of conflicts are likely to come up? And the interesting thing about that is that a lot of the time you'll see that an internal conflict then plays itself out with other people as well. So it becomes interpersonal, right? It's something that you're sort of playing out in your mind, and before you know it, you're sort of acting it out with someone as well.
Yes.
So it happens internally and it happens externally. And with caregiving, it's really important because people find themselves in a lot of interpersonal situations that they wouldn't normally find themselves in. All of a sudden you have to deal with family members that usually maybe you wouldn't be. You have to deal with the whole healthcare system, doctors, nurses. They have their own communication styles. They have their own agendas. So you have to sort of navigate through all of that. And then you also have your relationship with your loved one. That's something that can be very challenging because you're changing roles with them. All of a sudden maybe roles are being reversed. Maybe you're put into close proximity with someone that you used to have a different type of relationship with, so there's a lot of conflict that can come up there, and it's hard to figure out exactly how to work it out because you're also dealing with someone who's having a lot of hardship on their own. So how much of it can you share with them? How do you deal with that? And then the last piece of the presentation is more about coping strategies, the types of things that seem to work for people, practical things that you can do to sort of give yourself a break, to ease yourself into giving yourself time off, being present, being sort of present and aware. So we'll talk about different things that work for people. The first thing, though, that I wanted to do, I'm going to ask you a little bit of personal questions just because this is such an intimate format. Are you already sort of in the midst of taking care of someone, or is it something new that's on your mind?
My parents.
Your parents.
Yeah.
And has it been sort of a long drawn sort of situation, or is it a more recent development?
It's really more recent. Over the last couple of months, my mother is at the beginning stages of dementia, and my father has
Alzheimer's type, or just they don't know yet?
They don't know yet. Or maybe I just really didn't
Ask.
pay too much attention because just the fact that she's not herself is disturbing enough. And my father has a lot of physical problems.
Mm-hmm.
So in a way, he's sort of homebound now. He just came out of rehab.
Uh-huh.
So I have the two of them.
So you have the mental aspect, and then you have also the physical.
Right.
And so, because part of how I was going to structure the talk is also to kind of break it into people who have been dealing with this for a long time, and they're more dealing with the kind of cumulative effects of caregiving, the toll that it takes over time. But part of it is also with the first moments of kind of being faced with this new reality, how to plan for it, how to ask about it, who to ask about it, how to kind of prepare. And so, for example, when you told me dementia right away, I was curious to know what type, and and then you have to think about your personal style. Are you someone who wants to know a lot of details, or are you someone who rather not know so much?
I procrastinate, and my mother was seeing Dr. Kielsen, so he gave me a book, 36 Hours, something like that, and he said, read it. I haven't opened it yet.
Right.
I
It's
don't
hard.
deal very well. It's very hard.
Yeah. So that's one of those internal conflicts maybe that we'll get to, that if you're not somebody who wants to know all the details, that's fine. That's totally fine. But at the same time, you want to sort of know enough just to prepare yourself as to what to expect. Because, for example, if it's a fast progressing Alzheimer's, that's very different than an age-related dementia. They progress differently. The types of impediments that you're going to see first are going to be different. So with Alzheimer's, you may have to worry more about whether this person is going to go grocery shopping, and even though they've been doing this their whole entire life, at some point they're not going to be able to find their way home. So that's something that you kind of have to plan ahead and know that that's coming up, maybe in a month, maybe in 3 months, maybe in 6 months, but that's something. Whereas if it's a different type of dementia, then maybe the first things will be more like losses in short-term memory, and so it's important to get some kind of information just so you know what to expect. What are you looking at here? And that makes a difference, in terms of what we're focusing on, because when you're just starting to become acquainted with it's a different kind of challenge than just keep doing what you're doing already, right? There's a lot of resources that you have to mobilize, you have to ask people, you have to, I don't know, if you find out what it is, there's a lot of websites where you're going to get information that's specific to anyhow. But let me ask first a question that I was going to address just in a more general way. When you think of yourself as a caregiver, what's the sort of first feeling or association that comes to mind for you?
Just a big responsibility. I can't sleep at night. I wake up and I just worry all the time.
Right.
I don't know what's going to happen. What happens if one of them goes? They're very, very attached to each other. They're Holocaust survivors, and they've been together for over 65 years, and they can't live without each other. But yet, my father doesn't understand that my mother has problems.
He doesn't.
It's very hard. He tries to reason with her, and they both don't hear. So instead of me talking gently, and I have to raise my voice because otherwise they don't hear what I say.
Right.
So sometimes I come across harsh.
Right.
And I know I need to change that, but I don't know how to do it so they can hear what I'm saying and understand.
Right. But if it's an issue of really them not hearing, then you coming across as harsh may be just your own judgment of yourself, because really there's no other way for them to hear unless you raise your voice, right?
Yeah.
So responsibility comes to mind, and do you think that this level of responsibility and worry, do you feel like that's kind of helping you step up to what you feel you're up against? Hello, welcome.
Hi,
Come on in. This is Caring for the Caregiver. It's a workshop style, kind of interactive. Taking care of yourself as a caregiver, basically.
Thank you.
You're very welcome.
I'm having a private session.
That's very nice, actually. That's fine. I don't like
Whatever
to speak
your
in front of
fee is,
big
you're
crowds. So that's totally perfect.
Yeah, he was saying.
So does that feel like it's something that helps you cope, or does it feel sometimes like it's overwhelming that it actually gets in the way of coping?
I'm wonderful with guilt. I'm guilt-ridden from, I think, probably the day I was born.
Uh-huh.
So I feel I have to be there. I don't always want to be there, but I feel they're my parents. I have to take care of them, and I'm not handling it very well. I do have resentment. I do have anger. I guess everything.
And what's the guilt about, being that it sounds like you're doing everything that you're supposed to be doing and everything that you can be doing, and maybe even more than you could be doing?
Because I'm not doing it out of love.
Okay.
I'm doing it out of responsibility.
Out of duty.
Yeah.
So,
That bothers me.
okay, so that's really great because it's on the big list of things that I wanted to talk about. Okay, so let's start with guilt. Guilt is really kind of a wasted emotion. It really is. It's good for about 5 minutes, and it's good for people who are not sure about their moral compass, and they need guilt to feel human. They need guilt to feel like, okay, I have a conscience, and I know that because I'm feeling guilty right now. So for that, it's useful. So, kind of like teenagers, young adults who haven't thought so much about the consequences of what they're doing, and all of a sudden they're feeling guilt, that's actually positive, because that means that they're starting to become aware that they have responsibility towards others, that they have consequences. So for that, it's really a good thing. Past that indication that I have a moral compass and that matters, past that, it's just not a very useful emotion. And it's not just an emotion, it's really a thought process, which is good because it means that you can control it. Okay? Unlike some feelings that feel totally kind of overwhelming and from the inside, guilt is really more of a cognitive process. You talk yourself into guilt. So because you can talk yourself into guilt, you can also talk yourself out of guilt.
That's helpful.
But you have to want to do it. And I think a lot of us are attached to guilt because we feel like we're good people if we're feeling guilty all the time. So what I want to tell you is that you're a good person already because you're stepping up to this challenge and you're doing everything. So you already know that you have a moral compass. You already know that you're doing the best you can do. So you don't really need guilt as a whip to sort of keep you going. You're doing it already. And I don't think you're going to stop doing it if you have less guilt. I think you're going to do it better probably without the guilt. So I don't think you need it, and there's ways to kind of, to talk yourself out of it, because as I said, I think a lot of the time we talk ourselves into it. It's not really an elementary emotion, it's a secondary emotion. Like unlike happiness and sadness and anger, who are primary emotions, it's really a secondary emotion. It's a process of thinking that gets us there. So guilt is pretty useless, that's number one. Even anger, by the way, you get more mileage out of than guilt. Okay? Anger you can use
to move ahead.
You can use to move ahead. Guilt, it's a dead end road. It really doesn't go anywhere. So every time you catch yourself there, you can give yourself permission to move on because it's really not getting you anywhere. And at the end, by the way, I brought in these meditation CDs, which all they do is really foster kind of like, yeah, come on in. You're just in time. We're just getting into the fun stuff.
Okay.
I'm Lowinger. I'm a clinical psychologist. We have a nice handout here that you can look at, and we're going to sort of try to talk about how we can take care of ourselves as caregivers, feelings, thoughts, coping strategies, all of that. I'm sorry, I don't think I remember your name, if you told me your name. Shani. So Shani and I were talking about guilt as a primary emotion. I was asking her what comes up for her in terms of feelings. The first thing that comes to mind as a caregiver. I don't know what your situation is, where you're along the sort of path.
I'm happy to share since it's a small group.
Sorry?
I'm happy to share since it's a small group.
Yeah, that's the whole point. It's a workshop, it's interactive. We can just kind of use it the way that it best serves you, because that's really what we're here for. So are you a caregiver for a while now? Are you kind of new in this?
Since May.
Since May. So it's also relatively fresh for you. You're still absorbing. And can I ask you a little bit about what sort of situation you find yourself in?
Yeah, sure. So my father,
What's your name?
Sarah.
Okay. Yes.
So my father is 91 and he started with dialysis. So until May he was living pretty independently. I was still driving, I would come once a week. He lives in Stamford, Connecticut, and I was living in Brooklyn. So I was coming once a week, and his meals, everything was independent. In May,
I think we're going to close the door because this is disruptive, and if anybody wants to join us, they'll know how.
Yeah, go ahead. And then in May, everything changed because when he started dialysis, he stopped driving, and suddenly he needed a special diet. He wasn't getting his own meals anymore. he needed transportation and meals. So like mentally he's fine, he pays the bills and he's pretty okay mentally, but just in terms of physical care.
So where are you at now? You have to kind of go in multiple times a week to take care of...
I moved there. I was in Brooklyn, but I actually moved back to Stanford.
Wow. So there's a lot of big changes going on in your life. It's not a hypothetical kind of situation. It's really already taking a huge toll. So what's the primary feeling that comes up for you when you think of yourself as a caregiver? What comes up for you?
It's interesting. I guess on one hand there's satisfaction in knowing that I'm like taking his doctors will say he's doing very well. On the other hand, I don't want to be giving up. A feeling that comes to mind also is that I don't want to be like sacrificing my life for his.
Right. So you're in a dilemma of sort of how much do I do for him and at the same time maintain some kind of slice of my life that's still mine, that I can call my own. Which is not, by the way, so in terms of feeling, if you wanted to zoom in on a feeling, the first thing that comes to mind for you is pride. Anything else?
Yeah, sometimes annoyance, but not usually.
Like frustration?
Yeah, but not usually. Yeah.
And how do you deal with that when frustration comes up for you? You okay with it? You
Yeah, I'll tell him I can't talk right now. We can't help with this or that. I just say I can't talk right now.
Yeah, hello.
Yeah.
So you sort of, if you're angry, you kind of create a little bit of space for yourself. You know yourself well enough to know that that's happening and that you need a little bit of time. So we're talking about this not exactly, we're talking about guilt. And I was actually saying that guilt...
I have leftover guilt, so yeah.
Everybody has a little bit of leftover.
When my mother was sick, I just felt like I didn't do enough, so I'm sort of making up for it now. And guilt, I have guilt up to bigger than the universe, yeah.
Really? Okay, so we were talking a little bit about how guilt, and this is easy to say and hard to do, but it's even on an intellectual level, it's nice to start thinking about it that way, that it's really a dead end feeling. It's one of the most useless feelings that because, we're kind of faith-based people, and we feel like even feelings that Hashem created there for a reason, right? Anger is for a reason, sadness is for a reason. Guilt is really very limited. You get very little mileage out of it. The thing that it's good for is really when people are more in formative stages of their personality and they're trying to figure who they are. So guilt comes in as a way to understand that I have a moral compass, that I am an adult, that there's consequences to what I do, right? And in that way, it's helpful because it means that they're developing a sense of responsibility for others. Because a lot of teenagers and young adults don't really have that until something happens or until they mature enough to understand that. So there it's helpful because for someone who's kind of careless and goes around thinking like, whatever, starting to feel guilt is actually like we're getting a pulse here. That's good. Okay? But past that, and at the level where you are holding, both of you, you clearly are very responsible. You're clearly stepping up to the occasion. You're clearly doing everything you can do. So guilt at this point is not going to get you much more. You're already doing whatever guilt could possibly move you to do. It's not like if you're going to feel more guilty, then you're going to do more. You're just not going to sleep at night. And then you're not going to be having the energy to take good care or whatever it is. It's only going to get in the way. It's not going to serve you very well. So, and what I was saying also is that guilt is actually a secondary emotion. So sadness, happiness, these are sort of intuitive, instinctive emotions. Guilt, we work our way into it. We talk ourselves into it. Right. It's much more cognitive, which is good because it means that just like we talk ourselves into guilt, we can talk ourselves out of guilt. And even just knowing that it's a dead end feeling can help because whenever you find yourself there, you say, you know what? I don't have time to waste with this now. I have things to do. Thank you. Nice to see you. Talk to you later, right? You can start to get a feeling of when you're in it and make a choice to not be there because it's not doing a lot for you. Now, anger, I was saying, is actually, even anger is better than guilt because anger is a mobilizing emotion, right? When you're angry, You kind of get that energy, I'm going to go out there, I'm going to show them. So you can channel anger more constructively. You can, I don't know if you have examples, but I know people who were very frustrated with the medical system, whatever it was, communication. So after the loved one passed on, in this particular case, that person went on and started a whole advocacy group. And it was really the frustration that led to it. But they ended up mobilizing that frustration and helping a lot of people. Another great thing that you can do with anger is use it to empathize with your loved one. I do that in therapy. When I start getting frustrated with a patient, which happens sometimes, I think, oh my gosh, like let's say I have a patient who clearly is being self-destructive, but they just keep doing it. So I get frustrated. And then I think, if I am that frustrated with them, imagine how frustrated they must be with themselves. So you can use that to be more empathic towards your loved one. So that next time that they get frustrated, instead of just saying, oh, come on, it's not a big deal, you can say to them, you know what, I really know, and not in a patronizing way, I really know how you feel. I also get really frustrated. I mean, even if you don't say these words, but just the fact that you're really empathizing with them is going to do good for your relationship with them, and they're going to appreciate it. And everybody feels when it comes from a patronizing place versus when it comes from a, I hear you, like this is really, it's so frustrating. And you can do that with any feeling you have. When you're feeling very anxious, you can then probably understand better how anxious they're feeling, and then you can empathize with their anxiety. When you're feeling very sad and very helpless because you're doing everything you can and their situation is not necessarily getting better, so you can imagine that they feel a similar kind of helplessness, and then when they express something like that, then it doesn't have to be like, oh, stop it, you're going to be fine. It can be like, I know, it's really scary. It really is a very scary thing, and we're facing this together. I'm scared too. So a lot of these feelings, you can channel them and you can work with them. Guilt happens to be kind of useless. There's not a lot you can do with it. So the other thing that I wrote here that I think is important is ambivalent. So you're telling me, right, Shani, you're telling me that you feel like you're doing a lot for them, but you're doing it out of duty. So that's an ambivalence, right? Because it's kind of like, I'm doing it, but I don't really want to do it. I'm doing it, but at the same time, I'm kind of resentful about having to do it. So ambivalence is the bread and butter of human existence. We all feel ambivalent all the time. That's why we say one thing and then we do something else, because the conscious mind wants one thing and then the subconscious has its own agenda, and that's usually ambivalence. It means, I really want to go see this doctor, but then I missed the appointment because obviously part of me was scared and didn't really want to go see this doctor. So it's fine to be ambivalent, and what's important about it is to realize that two feelings that are opposite are not exclusive, right? With parents, you can love your parent and hate them at the same time. And it doesn't mean you don't love them, and it doesn't mean that you don't hate them sometimes. It means that our psyche is so complex that we can experience very complex feelings, and they're all true. It is really true that you care for them. It is really true that you want to do for them. And the fact that you're resentful about it doesn't take away from those other feelings. It just means that you also feel resentful. That's kind of the human
nature.
Yeah. Do you have any other thoughts about feeling ambivalent, about the struggles, about how it's hard, or how you deal with it that makes it easier? Nothing comes to mind. And then here at the bottom, I also have some of these positive emotions that you brought up, right? Pride and integrity, and being grateful about the possibility of giving back, feeling like you are, aligned with values that you have, that you're acting on values, that you're sort of concretizing things that maybe up until now have been more hypothetical.
Well, I'm trying to show my children that when the time comes, if God forbid, I or my husband need the help, at least they should sort of follow some sort of example that, so I try to.
Right, so you're setting a value system in place, and that's important because you're setting up a certain standard for care, for how to treat a parent, and you hope that will reflect back on you, and it usually does. So these are also important feelings, and they're important to offset a little bit the hardship, because if you can give yourself a little bit of time to feel that pride that you identified right away, then I think it makes it a little bit more worthwhile as you go through it. So, when we talk about sort of their condition deteriorating despite all of your best efforts, at least this kind of pride can remain, because that's not dependent on the outcome. That's dependent on the value system that you set up and the fact that you're following it, regardless of what the outcome is. A lot of the times with the ups and downs of an illness, we kind of come to sort of judge ourselves like, okay, they're doing well, so I must be doing well. They're doing not so well, so maybe I'm doing something wrong. So I think it's important sometimes to kind of take a step back and realize that what you're doing is not contingent on the outcome. The outcome will be whatever the outcome will be, but you're still doing the right thing.
So that's going to be hard for me to identify doing well, but when he starts to decline, I'm going to feel like responsible, like I'm taking pride in his doing well.
Right.
Yeah.
But you're not the cause of his decline.
Right, no.
And
It's easy for you to say.
I'm sorry?
Easy for you to say.
Oh, I had my parents also. So.
yeah. Right, but one of the things that are so hard with illness, right, is that we don't choose it, we don't sign up for it, and it feels like it's out of control. Or maybe we like to entertain the idea that it's under control, but at one point or another we realize that it's really not in our control. And then that responsibility becomes too great to carry if you go along with this idea that you're responsible, because it's not, at some point it becomes clear that it's not realistic to think that we're responsible for their well-being. That in a way, God is in charge, and none of us sign up for Alzheimer's, God forbid cancer, any of these things, obviously. So they're not in our control. You can do the best you can do, but that doesn't mean that we have control over the outcome. So that's actually a point on the second page. Actually, the first point there says, resisting the urge to feel personally responsible for setbacks and deterioration in the patient's condition. Hi, welcome. Come on in.
Oh, there's so few of us that care.
You can go ahead and take a handout if you like to follow along with us. So we want to sort of avoid feeling personally responsible for setbacks in the patient's condition despite one's best effort. Sometimes decline and disappointments are inevitable despite the caregiver's best effort. How does that feel for you to sort of think about that idea?
Yeah.
Sarah?
I think it's just important to separate what the condition is and what the wisdom to know the difference, right?
Mm-hmm.
You can change what you have control over, what you don't have, and to move it, right? So I need to accept the things I cannot change, the courage to change the things I can.
Right.
Wisdom to know the difference.
Right. Hi, welcome. So I'm just going to take a couple minutes to catch up the rest, but I'm not going to go over everything we covered, just maybe a little bit. There's a handout here if you'd like to take one. So we've been sort of talking about common emotional reactions so far to caregiving, and I asked Shani and Sarah so far what came up for them in terms of their first kind of association with caregiving. What's the first feeling that came up for them? So far we talked about guilt, and we talked about ambivalence, about kind of holding opposite emotions at the same time and whether they're exclusive of each other or not. And we kind of tried to come to terms with the dialectic of having opposite emotions happening at the same time. So wanting to do a lot for the loved one and at the same time being resentful about the great responsibility, or feeling very tender feelings and loving feelings and also feeling frustrated, right? Kind of holding different emotions. So I don't know how far along you are in the caregiving saga, if this is something new to you or if it's something that you've been doing for a while.
What do you call it? What's the parameter?
What's the parameter? I mean, if it's something recent in the last few weeks or months, I would say it's fresh. Otherwise, it's a while. Because, you know, what I was saying is the challenges also for people who are just, and what about you? Is that something that's come up recently for you, or have you been involved with caregiving for a while?
Been in healthcare for since 2011. So, but it's something that I guess internally struggle with
As a professional.
as a professional.
So you're here as someone who works with the elderly, not necessarily a family member.
Right.
Okay.
And but there is family also, but mainly I'm a licensed nursing home administrator.
Mm-hmm.
So yeah, it's working with the patients and also working with the caregivers. I don't know if I'm considered a caregiver. I was trying to figure out if I'm a caregiver or the people that would work under me.
Or you're auxiliary. You're
Yeah,
part of the caregiving system.
part of the caregiving system, you know. So.
Okay. Okay, great. And how about you? Welcome.
Hi, thank you. I'm sorry.
That's
would
quite
have
all
walked
right.
in earlier, but I'm still getting familiar. Yeah, my name is Mark Laster, and I'm actually a certified social worker.
Mm-hmm.
I've also been in geriatrics for my career, and basically, I guess it's both being somebody who is a professional, but also somebody who's a son.
Mm-hmm.
And right now, my father is 87.
Yeah.
And we just, you know, because I'm a professional, there are certain things that I saw happening. Of course, what do I know? You know, so nobody listened to me in my family, but now all of a sudden it's really beginning to manifest.
Mm-hmm.
So
What is it? Dementia that you're dealing with?
Dementia, and there's a lot of medical problems going on, which again we have to deal with first.
So we have to deal with. Are you the primary caregiver, or
I
you're?
have a brother.
You and your brother are
also
dealing
he has
with.
a friend, so it's like almost like the three of us.
Okay.
But the issue is that it's kind of split because he lives about 8 blocks from me. My brother lives all the way up in Muncie.
So
And
you're
his
the
friend lives
immediate
out in
caregiver. So you're the immediate caregiver, and then there's kind of like the long distance caregivers, and that's an issue that comes up a lot. How do you sort of split?
His friend is the one that he spends the most amount of time with. So she's probably the primary caregiver.
Okay.
But I work closely with her because, as we all know, sometimes people get very stubborn. And even though you kind of like it, especially being a social worker.
So before we get into that, I'm sorry to interrupt you. I want to stay close to each person experience here because we really only have,
Half an hour.
what is it? Like not even, like we have like 10 minutes on my watch, but we can probably go over a little bit because we kind of started all over the place. But I want to stay a little bit close to your experiences because I think that's what's going to be most helpful if you can come out of today here with something that is personally meaningful to you. So I think what we talked up until now with Shani was guilt, a lot of guilt, and whether that's a useful emotion or whether that's something that we can try to lose because it's not usually furthering us along the path of caregiving. We talked about pride, being proud of taking care, but also dealing with daily frustrations and ambivalence about those conflicting feelings. How about yourself? What would you say is the primary feeling that comes up for you when you think of yourself as a caregiver? You're not on the spot.
I'm not guilty. Okay, it's more resentment and anger
Mm-hmm.
for outside reasons, and I'm having a hard time with that.
Outside reasons, can you tell us a little bit more what you mean?
Don't want to go into it because, should I say, he didn't set up for this kind of situation, and he could have.
You mean that you
He did
didn't
not prepare.
know that you were going to become the primary caregiver, and you don't feel like you exactly chose it?
He did nothing.
Transference.
I don't want to say what he did, but you can surmise. And I'm very angry, and that's how I go
Who is the he that you're referring
my
to?
husband.
Your husband. And he is the person that you're
Yeah.
giving
So
care
I'm
to.
doing the care. I'm really not happy about it. But I'm that kind of person, I'll care for a dog, you know? So it doesn't make a difference who it is, you know, I'll take care of him, I'll feed him, I'll dress him, I'll whatever. I don't have to do that, but he has to be told what to do, because besides everything else, he had a stroke, but it's a complicated one. Subarachnoid hemorrhage, which doesn't fall into that category. He survived, which is a miracle. And he's left with, you might call it dementia, Alzheimer's. They're so vague on the diagnosis, even from Columbia and all the, but you know, he does have confusion at times, what day it is and so on, and he can do everything himself, but he won't do it. So I have to be there day to day,
I think the way we're gonna do this is I'm gonna try to address things that are meaningful to each one of you, because if I just go down the list, it's just gonna be too general and not as meaningful. But I think what you're talking about is that you are navigating your interpersonal relationship with your husband and the caregiving task together, which is very challenging, right? Because you have a relationship that dates back all the way before this happened, so there's a lot of history there. And on top of that, now there's this caregiving job that you didn't sign up for, but you're stuck with, right?
Plus I do something also, you know, I work at something and
you have your own life.
It's very meaningful to me, yes I do.
Yeah.
And I like my own life, and I'm very restricted.
Right.
Because, you know, the kids feel, okay, this is your job, and you're not even doing it as well, because they know.
So you feel that there's a lot of pressure, and do you? Is there, because one of the
I
things.
can include everybody's problems in my scenario, except the guilt. I feel no guilt whatsoever.
Okay, so you can give a seminar on how you accomplish that, because I'm sure you had guilt at some point or another, or maybe not. No. But what I wanted to ask you is, do you have, because one of the things that is important, I think, is to mobilize resources. So do you have meetings with your children, with a family, to sort of
negotiating something,
to negotiate some responsibilities?
Because it came to a head when I took my last trip.
Okay, because that's something that I was going to suggest to everybody here in the room, that really when you're dealing with something like this, a team approach is very important. You know, even if you're the kind of person who feels like you should be able to take care of everything and it's all on your shoulders, the reality is that in these kind of scenarios, you will burn out if you try to do everything yourself, okay? It's the type of thing that just doesn't work unless there is a team, or if you're really alone and there is no family, then there's resources in the community. There is, you know, Achiezer, there is organizations, social workers, there support groups online, anything that will help you diffuse the responsibility and shoulder it with other people is really key. And I wanted to talk maybe a little bit later, but we can do it now. If you think that there's roadblocks to you utilizing help and support from other people. For example, getting your children involved in the caregiving. What gets in the way of doing that? Is it guilt? Is it the fact that you don't know what the resources that are available? Is it pride? Is it the fact that you're afraid to burden other people? Like, what do you think are roadblocks for you that get in the way of utilizing and mobilizing support? Is that something that sounds...
Good question. Excellent question.
Yeah, I have some. I'm dealing with a family member who's really depressed, and I feel inadequate because I'm not a clinical social worker, or I'm not a therapist. I'm not a suicidal counselor or something like that. And like, if I'm talking to the person and they're going through a hard time, I feel like I'm not really the right person to be dealing with this. But as a family member, I love them, and I want to be there for them, and I want them to open up to me and stuff. So, but the roadblock, I think, is dealing with maybe a dysfunctional family, dealing with secrets, and this one can't know, that one can't know. In order to have a team, in order to have a meeting, everybody has to be on the same page. That's the hard part.
Right.
And that's bringing it into the light, and that's talking about it in an open forum. That's the hard part. So, so that's the roadblock.
The flip side to that is that this may be something that will push you to try to do something about it, and that it is better that there's an effort at least now rather than later, or that maybe without this that would never come up. So maybe the only redeeming thing here is that at least there's an impetus, there's a motivation now more than ever maybe, and that maybe you all have a common goal, even though you have different ways of going about it. I'm assuming that other people in the family are concerned.
They probably know about it too.
They probably know about it. So you have now a common goal that might provide some kind of bridging opportunity over whatever underlying separate kind of issues that have been going on. An idea is also to get a professional involved, right? Like you're saying, you're meeting with a counselor. Sometimes it's really helpful to just have an objective third person who can kind of let everybody say what they have to say and have everybody else listen. A lot of the times what I'll do with a family really is just have each person say their piece and then ask the other people, have you heard what he said? And the answers that I'll get are amazing. I mean, I have no idea how they came up with it. I'm like, is this really what you meant to say? And they'll say no, but this is what this person heard, because they're hearing whatever they've been hearing for the last 20 years. They're not actually hearing what is being said. Right. So just an exercise in having people listen to each other and check back. And you can do this by yourself, if there's enough cooperation. I'm gonna give you the next, to just check in, what have you heard him say, and then to go back and check, is that what you meant to say? And just that could do amazing things, because then you're actually having a conversation where people are listening and reacting to what's being said rather than whatever. Okay,
right,
go ahead.
In terms for me, excuse me, the barrier in terms of my brother getting more involved, it's actually over two barriers. One, as I mentioned earlier, distance. The other thing is that my brother's is religious, and my father's friend is not Jewish. So my brother had a lot of difficulty. In fact, up until Friday, my brother absolutely refused to talk to his friend, even though his friend, I would speak regularly to his friend. We were kind of like providing the care as a coordinated team. My brother was not a part of it because he didn't want to speak to her. And then it was really beshared because I could make the appointment. We set up an appointment for Friday. I could not make it. And I was shocked because my brother agreed to make it, and because his friend was supposed to have made it, I thought my brother would go. They both ended up going, which
Right.
I was shocked. And
Because they have a common goal, right? So that's what we're
Exactly.
talking about, that when you have a
Exactly.
common goal,
Exactly.
then other differences might sort of become a bit more secondary.
Today, I probably have the longest conversation. I had a 2-hour conversation with my brother all about my father's care, which I've never had since my mother passed away.
And I want to tell you that when this parasha is over, right, that will be one thing that you might be left with that you will need more than anything, which is that closeness with your brother, because now that's the team that's left.
Yes.
So the relationships that you are nurturing now in the context of taking care of a loved one may end up in the long run also be your best support system when you need it later down the road, when you have to kind of rebuild your life aside from the caregiving task. So it can be that in the best case scenario. It can lead to that. It can help you in that. But just one more thing, there's also wonderful technological devices that you can use when families don't function well. Like you can have a calendar online where people put in the tasks that they can do. So even if you're not the best communicators, I'm just saying there's ways to get around it if your goal is really to mobilize resources and if you're willing to do whatever it takes to do that.
Well, we did my father's care not that long ago. And I don't know, it just fell into place. Yes, we did have, kind of our big family. We have people in Israel, and we had members in Colorado and in Michigan. But everybody seemed to fall into place. I know what I did because I took care of his medical needs. If he went to the doctor or whatever, I would go wherever I had to go. And it was a good thing I was his advocate because the doctors needed. I'm not going to go into that. But somehow it just, like I said, fell into place. And here, I don't know what these kids are thinking. You know, they have this idea that the father is the never and the mother is the capable one, you know, so that's why maybe I'm under attack, I don't know.
And the question is also, you know,
How can you enlist their cooperation?
Well, it's going to happen now, if not, they could have them.
but that's a very good
I tell
question.
you. I know I sound dreadful, but there's a lot of...
And the other thing, you know, is that really it's their relationship with their father too.
So that's why I don't know why they're not coming, you know, they'll say, oh, he needs more stimulation. Where are you? Come on.
Come see it.
So when have you had a family kind of meeting
We
where...
did in the beginning and maybe toward, you know, the middle, and then things started to fall apart, and now it's coming to a crisis because I did maybe a little bit more leaving than they liked. And I did not enlist them at the last one just to show them, that's it. I've had it. A neighbor took over. And he, like I said, he doesn't need data. The kids slept over, then he ate with them. And then when my son came, Erev Shabbos, to try to get him, he didn't even want to go. He must have felt, you know, why didn't they take them to begin with?
Right, so these are things that you really need to kind of address together. And the reality is that if it gets to a point of a crisis where you don't feel like you can do it at all, then everybody has a lot more to lose, versus when everybody kind of shoulders some of it and allows you to continue to be able to do what you can do, right? In other words, you don't want to go around creating this image of you as being superwoman and being able to do everything, and then one day you crash because it's too much. You want to sort of rather create a situation where you are getting the support, because this is not a sprint, it's a marathon, right? It's not a short-term thing where you can say, okay, forget about everything else, I'm just going to give myself entirely to the task. You have to plan for the long term. And in the long term, you need to have something sustainable. You need to have something that you can imagine yourself doing for however long it needs to be done.
And don't get me wrong, I don't mind doing it. But, you know, give me the support.
Right.
Then I'll do what I have to do. Just let me do what I also want to do. I always said I do what I have to do, what I want to do. I need to do what I want to do also.
Right.
Very simple.
It sounds something that can be accomplished if there's enough communication and goodwill. It sounds reasonable to me.
Sometimes we feel like we have to give up our lives and you know, move into their life. And it just can't do it.
But you are. That's the whole thing. You are, but you do need that relief.
Right. Yeah, I do. I need to get away. I need to
When do you want
take
to go?
a day off.
Right.
I'm planning a trip. My sister will have to come and take care of it.
Right. And that's part of, I think, a very kind of good concept to have in mind. 5 minutes? Okay, 5 minutes. There's such a concept of kind of defining your commitments. Defining your commitments means that you need to have, it can be flexible, but it needs to be a roadmap of what you are and are not willing to do, okay? So for some people, it could be something as simple as, when it gets to toileting, I can't handle it anymore, it needs to go to a facility, okay? It could be something like, I mean, we all know what we're good at and what we can and cannot do. I can do this as long as I can hold on to my job. I can do this as long as I can still spend X amount of time with my children or with my grandchildren. So I can do this if it's in my house, but not if it involves me bathing and changing. I mean, everybody has their own limits, and we have to sort of have a roadmap in our own mind of what it is that we can and are willing to do. And I think it's important, and it sounds like, okay, well, I kind of know, but the truth is that when you're in the situations, you might put yourself into a situation without thinking about it, and then realizing that you reached too far, and now everybody's expecting you to do that. Whereas if you kind of think about it in advance, you can have a discussion with the family, and you can say, hey, look, this is what I can do, and this is what I need other people to do. Who's going to step up and help me with this? Who's going to step up and help me with grocery shopping? Who's going to, you know, whatever it is, it's very important that you go into these meetings and you go into these decision-making states knowing what your commitments are and are not. And that includes, you might want to think about your relationship with the ill person, right? So if there's certain negativity, certain emotional aspects that are very tense for you, that you feel are going to get in the way of doing certain types of things, that needs to be taken into account, right? Or if it's, let's say you're taking care of a mother-in-law, just the gender might make certain types of situations awkward, right? So you have to think about who this person is to me, what's my relationship with them, what will feel respectful, what will feel disrespectful, yes.
Have you seen that in some families, people just step out and establish themselves as the most competent caregiver, and that sometimes makes it difficult for others to step in and feel that they can fill the shoes? So you might want to step away, but since everyone sees you as the person who gives the most competent, the best care, it's hard to take that break.
Right. Because you kind of establish your identity as the sort of captain of the sheep, and there's nobody who can sort of take over.
So how do you make space in those situations for other people to feel that they can pick up some of the slack?
Right. So that's a very good question. I think that's a question that one has to ask oneself.